Welcome to the Area Agency on Aging 1B, October 2017 MAP update training. This training will focus on 2018 updates to Medicare and the Medicare Plan Finder, tools that you will need in preparation for the upcoming open enrollment season. Our first order of business this year is new Medicare cards. As you all know, beneficiaries will begin receiving new cards starting in April 2018. They should arrive by April 2019. The Medicare Access and Chip Reauthorization Act of 2015 has required Medicare to remove Social Security numbers from all Medicare cards by April 2019. A new randomly generated Medicare Beneficiary Identifier number will replace the Social Security number on the Medicare cards. This number is applicable to Medicare transactions like billing, eligibility status, and claim status. This act is referred to as the Social Security Number Removal Initiative, or the SSNRI. Under the new system, each person enrolled in Medicare will receive this new Medicare Beneficiary Identifier and be sent a new Medicare card. It's important to remind beneficiaries that the MBI is confidential, like their Social Security number was on that card, and should be protected as a personally identifiable piece of information. The timeline is that the cards will be mailed between April 2018 and April 2019. There will also be a transition period where either the original Medicare card or the new MBI card can be used. The transition period will begin in April 2018 and should run through December 31, 2019. This new identity number will not change Medicare benefits. Beneficiary doesn't have to do anything to receive this card, and people with Medicare may start using their new Medicare cards and numbers as soon as they get them. It's important that we let beneficiaries know that scammers are posing as Medicare representatives, calling and asking for current Medicare numbers and offering to send a new card. Remind them that they do not need to do anything to receive their new Medicare card. Medicare will not call beneficiaries out of the blue and ask for a Medicare number. If this happens, it's likely a scam. Remind folks, do not give out your info over the phone, and let them know that if an incident like this happens, they should report it to MAP. We will have flyers explaining the new Medicare cards and numbers for you to distribute to beneficiaries at our open enrollment counseling events this year. Part A and B premiums. This is the information that everyone is waiting for, and as every year, we need to ask you to stay tuned. Those premiums will be announced in November or early December, and we will share the information with you as soon as it comes to us. Observation status versus hospital admission. This is an issue between what does Part A cover and what does Part B cover. As a refresher, observation status is covered by Medicare Part B, and hospital admission is covered by Medicare Part A. The issue is that Part B copayment that's owed if someone is in the hospital under observation status. Also, skilled nursing facilities, Medicare only pays them after a 3-day hospital admission under Part A. There are also issues with prescription coverage. Remind beneficiaries that they should verify their admission status with their admitting physician and the hospital. Now, this is made easier beginning this past March with the MOON, the Medicare Outpatient Observation Notice. Hospitals must issue this MOON to people with original Medicare and Medicare Advantage plans if they are in the hospital under observation status. This must be delivered to patients or to the patient's representative within 36 hours after the observation services begin. And CMS is making it available in both English and Spanish, and in PDF and Word formats. The healthcare marketplace and Medicare. The marketplace and Medicare are not designed to work together. When someone becomes eligible for Medicare, they can drop marketplace in favor of Medicare coverage. If someone is eligible but does not enroll in Medicare, however, they lose the tax credits for the marketplace that are currently in place, and they may be penalized for not enrolling in Medicare. Health savings accounts to Medicare. Most people should enroll in Medicare when they first are eligible to avoid penalties. If someone is Medicare eligible, still working and covered by an employer plan, they may consider postponing Medicare enrollment. Enrollment in any part of Medicare, however, makes someone ineligible for pre-tax health savings account contributions. If a beneficiary delays enrollment in Medicare Part A is applied 6 months retroactively. So the beneficiary should stop contributions to their HSA 6 months prior to signing up for Medicare. If the beneficiary starts collecting Social Security, he or she will automatically be enrolled in Medicare Part A. If a person does not enroll in Medicare, but the spouse does enroll in Medicare, the spouse's enrollment will not affect the person's eligibility to make contributions to their HSA. A person becomes ineligible for pre-tax HSA contributions on the first day of the month that their Medicare is in effect. Now, a beneficiary may continue to withdraw money from their HSA after enrollment in Medicare to help pay for medical expenses such as deductibles, premiums, co-payments, and co-insurances. If the account is used for these qualified medical expenses, it will continue to be tax-free. Here's a look at the fall timeline, what to expect, what beneficiaries can expect. In early September, the Social Security Administration reviewed low-income subsidies. Late in September, they sent out the annual notice of changes and Medicare and U booklets. In October 1st, marketing of plans begins. On the 15th, open enrollment period begins. In mid-month, the prescription drug plan star ratings are issued, and we will let you know those as soon as we receive them. Then late in October, non-renewal notices are mailed and low-income subsidy redetermination notices are mailed. In November, the Part A and B premiums and cost of living adjustments should be announced. If not in November, it'll be in early December. Then December 7th, open enrollment ends, and on January 1st, the plan's coverage begins. As you know, continuous open enrollment for Medicare's Part D drug benefit is not allowed. Most beneficiaries have limited timeframes to enroll in, disenroll from, or switch Part D plans. There are 3 enrollment period categories. The initial enrollment period, which is that 7-month period surrounding a beneficiary's 65th birthday, 3 months prior, the birth month, and 3 months after the birth month. The annual open enrollment period, which is October 15th through December 7th. And special enrollment periods, which are triggered by things like moving, obtaining a low-income subsidy, and loss of coverage. In an effort to promote better plan quality and better choice, Medicare sends notices to those who are in a Part D drug plan or a Medicare Advantage plan that fails to get at least a 3-star quality rating for 3 straight years. The notice lets them know about a special enrollment period to enroll in a 4- or 5-star plan. We will share more information about this special enrollment period for this year as it's made available. In a similar effort to promote informed and better choice of high-performing plans, Medicare has disabled the online enrollment feature in the Medicare Plan Finder for plans that are low-performing, 3 or fewer stars for 3 consecutive years. These plans will have a low-performing icon along with a message warning consumers of the plan's poorly rated performance. There's an example of this in the box on this slide. Your clients who are still interested in enrolling will get another message letting them know they will need to call the plan directly to enroll. Medicare Advantage disenrollment, special enrollment period. That is from January 1st through February 14th, and beneficiaries may switch out of the Medicare Advantage plan and into an original Medicare with prescription drug plan, January 1st through February 14th. Coming in 2019, there will be an extended Medicare Advantage disenrollment period that will run January 1st through March 31st, 2019. There are some changes to the Medicare Plan Finder this year. The first one that MAP has asked us to highlight for you is that the stopmedicarefraud.gov link has been removed from the Get Involved with Us section at the bottom of each page at medicare.gov. The Twitter, YouTube, and podcast links in that area are still active. Another big change in the Plan Finder is the question marks. There used to be a question mark to many of the items in the Plan Finder that would help you get more information on that item. Now you can simply hover over virtually every item in the Finder, and that will open a bubble that contains more information on that item. That's particularly relevant in the Enter Information page and in the Refine Your Plan Results page. Medicare is offering Plan Finder training to help familiarize you with the smaller tweaks in the Plan Finder this year. This URL will take you to the Plan Finder training site. The test cases on the following slides should be used for personalized searches. They're being provided as a training tool for some beneficiary situations that you may find when counseling. Here are 3 scenarios that you can enter the information at that URL for the Plan Finder training. And if you would like some additional scenarios, there are a few more they've given us. Just contact your site coordinator and we'll send you a list. Medicare Plan Finder reminders. With a personalized search, a beneficiary's current plan is auto-loaded, including any drugs previously listed through the Plan Finder or at mymedicare.gov. Make sure that you write down the beneficiary's drug list ID and include it in your Ship Tools report. And a suggestion is that you change the password date, which automatically defaults to the date that you're creating the drug list. Make it the beneficiary's birth date so it will be easy to remember. And when you enroll someone in a plan, don't forget to poke the bird. When you poke the bird, you get credit and we get credit for enrolling a beneficiary in a Medicare Part D plan. The bird is a very faint watermark at the right of the Your Personal Information box. It opens the Partner Information box, circled below. In that box, you will want to fill in the agent ID, which is the MAP phone number with no punctuation or spaces. Open enrollment period, frequently asked questions. You've enrolled a person in a prescription drug plan or a Medicare Advantage prescription drug plan, and he or she changed their mind. Can anything be done? Yes, you can go ahead and enroll the beneficiary in another plan. The last enrollment during open enrollment is the plan that takes effect. Can you enroll a person in a Medicare Advantage only plan with no drugs and a prescription drug plan? If the Medicare Advantage plan is an HMO or a PPO, no. If someone enrolls in an MA, HMO, or PPO, he must get the drug coverage through that Medicare Advantage prescription drug plan. Now, if it's a fee-for-service plan, yes, someone can enroll in a fee-for-service plan without drug coverage and enroll in a separate PDP. If you have plan finder problems during open enrollment, first rule out any issues with your computer or your network. There might be issues with the plan finder bandwidth, slow loading. We all run into that during open enrollment. We can report the problem to CMS, and sometimes they can do a reset and help fix that slow loading. Do be aware that peak times are 11 a.m. to 5 p.m. and things might just run slowly. If you're having issues with plan finder accuracy, loading the appropriate information for the beneficiary, we do have an MPF intake form that you can file a report, or to get some work done, you can just try doing a general search on behalf of the beneficiary. (2018) Part D Standard Benefit Structure for prescription drug plans and MA plans. Here's a chart that details the 2018 standard drug benefit. The standard deductible for 2018 is $405. The initial coverage limit is $3,750. Out-of-pocket threshold is $5,000. And the minimum cost sharing during catastrophic coverage is $3.35 for generics and $8.35 for brand name drugs. In the coverage gap discount, the beneficiary will pay in 2018 35% for name brands and 44% for generics. Here's an illustration of the 2018 standard Medicare Part D basic drug structure. As you see, the deductible is $405. When the actual prescription drug cost is between that deductible of $405 and $3,750, the beneficiary has partial coverage and will pay 25% of the drug's cost. During that donut hole, that's between the actual prescription drug cost of $3,750 and the top end, which is $8,417.60, beneficiaries will pay 35% of the brand name drug cost and 44% of the generic drug cost. Once they reach catastrophic coverage level, which is above $84.17 in actual prescription drug costs, they pay 5% of their prescription drug cost. As we said, in 2018, beneficiaries who reach the donut hole will pay 44% for their generic medications and 35% for brand name medications. In 2019 and beyond, the donut hole will continue to close until it will be completely gone in 2020. In 2019, we understand that beneficiaries will pay 37% for generic and 30% for brand name drugs. Here's a chart that shows the progression of closing that coverage gap or donut hole through the years. Part D late enrollment penalty. If a beneficiary does not have creditable coverage and does not enroll in Part D, then he or she must pay a late enrollment penalty. That penalty is added onto the monthly premium, and it will continue as long as the person is enrolled in Part D. The calculation of the penalty is calculated as 1% of the Part D base beneficiary premium, which is $35.02 for 2018. It is applied for each month a beneficiary does not have creditable coverage and is not enrolled in Part D. The penalty amount changes each year as the Part D base beneficiary premium changes. Here's a calculation that shows you what the current late enrollment penalty would be for someone who never enrolled in Part D and needs to do so now. This is an example of how significant that penalty can be. If you start counting from June 2006 through December 2017, there were 7 months in 2006, plus 11 years from 2006 to 2017. So you convert to months, you have 139 months, that's 139% penalty times 3502. So the 2018 monthly penalty is $48.67. Part D income-related monthly adjustment amount. Part D premiums are subject to income adjustments similar to Part B premiums. Beneficiaries with significant income will pay sliding scale higher Part D premiums. There are 4 income categories. Each category has a set dollar amount associated with it. This affects fewer than 5% of the Medicare population. And here is a chart for your reference that shows the income thresholds prior to 2018 and the changes in 2018 and the percentage that will be paid by someone in this income threshold. Beginning in 2018, this provision would make adjustments to the current law's income-related premium. The provision adjusts the amount of the income thresholds for applying the income-related premium as shown on this table. Beginning in 2020, the income thresholds will be adjusted each year by increasing the previous year's income threshold amounts by the Consumer Price Index for urban consumers. (2018) low-income subsidy, extra help. Those income thresholds are based from the federal poverty level, which is announced in January. If a person is eligible now, they will be eligible for the remainder of 2018. Meet the plans. Here's a look at the 2018 prescription drug plans and Medicare Advantage plan highlights. 2018 plan statistics. The total number of prescription drug plans available this year is 24. The number of enhanced plans are 11, and the number of basic plans, 13. The number of plans with a $0 deductible are 8. The lowest premium with a $0 deductible is SilverScript Basic. That's $29.10. The percentage of $0 deductible plans is 33%. The number of plans with a premium less than $25 is 4, and that's 17% of the available plans. The lowest prescription drug plan premium is $12.60, and that is the Envision RX Plus. The highest PDP premium is $102.60, and that is Prescription Blue Option B. The average prescription drug plan premium is $42.13. 2018 Medicare Advantage plans. The lowest premium, which is 0, there are 8 plans. The highest premium is $312.50, and that's one plan, the Medicare Plus Blue PPO Assure. And the number of plans varies from county to county. Here's a list of the number of MA plans that are available in each of the counties that Area Agency on Aging 1B services. Medicare Advantage plans and extra benefits. If a person is in a Medicare Advantage plan and switches or disenrolls and has a dental rider, That rider is still in effect, and it must be canceled separately. My HealthLink plans. The counties in the state of Michigan that offer My HealthLink plans are Macomb, Wayne, counties in Southwest Michigan, and all of the Upper Peninsula. That's integrated care for dual eligible beneficiaries, and the 5 insurance plans that offer this in Macomb County, the only county that's within the AAA 1B region, are Aetna, Better Health, Michigan Complete Health, AmeriHealth Michigan, HAP Midwest Health Plan, and Molina. For those of you who counsel in Macomb County, or those of you who might have an opportunity to talk with Macomb County beneficiaries, please take a look at the web page on My HealthLink, which can be found through this URL. That will give you complete information on the program and explain how to get in touch with those individual plans. The marketing guidelines for Part C and D plans, just as a reminder, they cannot market themselves as Medicare endorsed. They do not solicit door-to-door. They cannot call people on national and state do not call lists. They cannot enroll people over the phone during a solicitation call. They cannot offer incentives or gifts that are over $15 in value. They can't market outside a plan's service area. They can't engage in activities that mislead or confuse beneficiaries, and they cannot conduct sales presentations or collect enrollment applications at health fairs or other educational events. Here's a review of Medigap basics and general updates. Medigap has standardized plans. They have 3 different rating methods. Community rated charges everyone in the community the same price regardless of their age. Issue age rated, a rate is charged when the policy is issued, and that rate stays stable, adjusted only for medical inflation. An age attain rated is prices increase yearly as the policyholder ages, in addition to adjustments for medical inflation. An important Medigap note, not all Medigap plans will sell to a person who's under age 65 with a disability. But if a beneficiary is under 65 with a disability and does have a Medigap and then turns 65, he or she is eligible for a Medigap open enrollment period. Here's the chart from page 80 of Medicare and You 2018 that shows the details of each Medigap plan that's sold. Remember, no matter which company sells the Medigap plans, all of the benefits are the same. If they sell an A plan, no matter what company they are, it needs to offer these benefits. Same with all the others. The thing that's different is cost. They don't all charge the same for the Medigap plans that they sell, nor are they required to. Changes to Medigap in 2020 and beyond. Effective in 2020, no new Medigap plan C or F will be sold. The plans can choose to keep their existing members in 2020, and they probably will grandfather them in, but there will be no new enrollments in C or F in 2020 and beyond. Medigap A, B, D, G, K, L, M, and N will continue to be sold. The Medigap subsidy is offered by the Michigan Health Endowment Fund. Person must be enrolled in a plan from a participating insurer first and then apply for the subsidy. The Medigap plan needs to be from Blue Cross Blue Shield of Michigan, Blue Care Network, AARP United Health, or Priority Health. To qualify, they must be a Michigan resident, a Medicare beneficiary, household income limits, as well as already have that Medigap plan. The subsidy is paid to the plan, which in turn reduces the beneficiary's monthly premium. And beneficiaries who are receiving full Medicaid benefits are not eligible for the subsidy. The Michigan Health Endowment Fund subsidy the subsidy amount received depends on the beneficiary's age. Those under 65 and those 75 years or older receive more money because their premiums are higher. Here's information on how someone can apply for the Medigap subsidy online, by calling, or by filling out and sending in a paper application, which can be mailed to them by calling or downloaded. The Michigan Medigap subsidy is guaranteed to run through the end of 2018 only. It may run through 2021 if funds permit. Some tips on how a beneficiary can shop and should shop for Medigap plans. Things to consider. Are they in an open enrollment or guaranteed issue period? What is their health status? That can be considered with medical underwriting by an insurance agency. Their age, the type of Medigap plan that they want, of course the cost, and customer service should be an issue as well. The Medigap resources for finding out more information about Medigap plans are the Medicare.gov Plan Finder, the Michigan Department of Insurance and Financial Services, or DIFS, the Michigan Association of Health Plans, and their URL is right there, as well as the Michigan Medigap Plan Finder. That interactive spreadsheet has been updated with the 2018 costs for Medigap plans. It is available in ShipTools if you search the library for Medigap Plan Finder for entire state, or you can request a copy from your site coordinator. The biggest counseling tidbit that we have to offer this year is the ShipTools Part D Savings Pilot. There was a webinar in September presented by MMAP that explained this. It's a new way to calculate and report Part D enrollment savings. It is not being done throughout the country. Michigan has been chosen to participate in this pilot, and the goal of this pilot is to show Congress and the federal government that the SHIP programs, of which MMAP is one, actually do save beneficiaries money. We are helping to prove this to help keep us in the budget. So for thorough training, please review that webinar that MMAP offered in September. You can search in the ShipTools library for the title, MMAP Monthly Webinar, September 2017, Part D Savings Pilot. This training includes a few screenshots with some instructions of how to complete these new Part D savings sections. But you'll really get the most information from that webinar. You note that the only way that the pilot is applicable to your work is if you choose box 4, which is a prescription drug plan enrollment assistance, or box 30, which is a Medicare Advantage with prescription drug enrollment assistance. This applies only to enrollment assistance, not to comparison or other assistance. And if you click either of those boxes, a few mandatory additional questions will appear. You will find the information that you need for ShipTools in the Medicare Plan Finder. Take a look at the rest of these slides for the steps that you'll go through. And if you follow the steps, ShipTools does the necessary saving calculations for you. Once you review that MMAP video, it will all make sense. And finally, during open enrollment, remember, make sure you report every beneficiary contact in ShipTools. Make sure that you incorporate fraud education into counseling, particularly the scam warning about this new Medicare card, and share that new Medicare card flyer that we'll provide you. Poke the bird if you do a Part D enrollment. And if you haven't already, please sign up to help at one of the Medicare open enrollment events. And if you have any questions as we come up on open enrollment, don't hesitate to contact your site coordinator.